Hello people, in this video we want to look at the top priority questions from Psychiatry in your general medicine in MBBS. So the topmost priority you have to give is for Schizophrenia. This is a psychosis. So basically in this person will have hallucinations. We have a separate video on Schizophrenia. Hope you have looked at that anyways. So just look at the things. There'll be positive symptoms and negative symptoms. Positive like delusions, hallucinations, disorganized speech. Remember hallucinations. And the negative, they will have a flattened effect, a reduced speech and lack of initiative. There can be something called as catatonia. That is awkward postures they can adapt, okay, for a prolonged period. So this is catatonia. The differential diagnosis can be mania, depression, drug therapy if somebody is taking Huntington's disease, temporal lobe epilepsy, etc. Management of schizophrenia, you have to rule out everything else, and then if it is schizophrenia, you have to give antipsychotics. You can give MOAs, then you can give chlorpromazine, haloperidol, olanzapine. Clozapine only you will give if you cannot, the other drugs don't work, right? Yes, see here. So you will give atypical antipsychotics, risperidone, olanzapine, etc. Only if in resistant cases they are giving clozapine, okay? So that's overall about schizophrenia. You should know about antipsychotic drugs, very important. So antipsychotic drugs classification from your pharmacology. You have phenothiazines like chlorpromazine. Then you should know about haloperidol. Then atypical, you should know about risperidone, olanzapine, clozapine. Please remember these. This is what they said they will give, right? Risperidone, olanzapine, clozapine. And mainly you should know what are the side effects of antipsychotic drugs. They are dopamine blocking. So if they block dopamine, what are the side effects? So you can see here dyskinesia, dystonia, akathisia, Parkinsonism, gynecomastia, all that you can write. But remember mainly dyskinesia, dystonia, akathisia and Parkinsonism. Very, very important to know the side effects of antipsychotic drugs also. Okay. Then there are a lot of other side effects which you are looking at in this image. Shall we move on to the next priority question from your psychiatry? Okay, the next priority question from your psychiatry is electroconvulsive therapy. This is actually given as a treatment for depression. Okay, so they'll give high voltage direct current impulse. Now let's move on to this delirium tremens. What is delirium tremens? It's alcohol withdrawal will cause this kind of problem, right? So what treatment will you give for delirium tremens? They're talking more about sedation with benzodiazepines like lorazepam, diazepam, right? So basically they will manage the withdrawal symptoms and reduce the risk of seizures. We are moving on, people. Are you with us? Now let us look at Wernicke's encephalopathy. Wernicke's encephalopathy is basically because of thiamine deficiency. What will happen in Wernicke's encephalopathy? There will be nystagmus, ophthalmoplegia with ataxia and delirium. Okay, so this is what is Wernicke's encephalopathy. Without prompt treatment, it can progress and it can become irreversible. Okay, so that is why how will you treat it also? By giving thiamine. So mostly you will see this in alcoholics, etc. Even in hyperemesis gravidarum, if there is too much of vomiting and if they are having electrolyte imbalance, etc., thiamine deficiency can result. Okay, that's why in pregnancy also they give thiamine. So not just vitamin B1, that is thiamine, they're giving all types of vitamin B in this vitamin B complex capsules. So are you able to understand, people? Now let's move on to depression. See, most people, right, when you're sitting in an OPD come with depression, okay? And it is very easily treatable with SSRIs, fluoxetine and Fludac, right? That is a drug that they prescribe for so many people. So you should know about depression, especially in the elderly. They keep prescribing this because their thinking is very, very different and they go into depression, okay? So there is a feeling of sadness, lack of interest, self-neglect. There can be anorexia, sleep disturbance, suicidal feeling. So are you able to understand? So what exactly is happening in these people? Monoamines are less, the serotonin, that is noradrenaline, is it? And dopamine are less, and then brain-derived neurotropic factor is less. So basically there is some abnormal hypothalamus pituitary adrenal axis, or the thyroid function can be abnormal, or the sex steroid levels can be abnormal. Okay, so basically all this you should know. Then how will you treat, focus here, people, are you focusing? How will you treat? You will give SSRIs like fluoxetine, like I told you here, it is marked here. Are you able to see? This is the drug that I saw is given a lot to these people who come in. And with it, you can add one more drug. Wait, let me find the name of that. It was mirtazapine, guys. I saw that being prescribed a lot. Okay, mirtazapine. Now let's move on to the next question, which is very important for you in psychiatry. That is panic disorder, panic attacks. This you should always be able to distinguish from heart diseases. This you're seeing from the Davidson textbook. Guys, remember Davidson is more than sufficient for you. No need to buy separate books for psychiatry and dermatology. Just your dermatology textbook is enough. Okay. So now look at this panic disorder. Basically repeated attacks of anxiety. Severe anxiety is called as panic disorder. Okay. And it is not restricted to any situation or circumstance. It just comes and goes. Is it? So they'll have chest pain, palpitations. So that's why I told you should be able to distinguish it from heart diseases. Okay. So this panic disorder is coming under anxiety disorders, that you can understand. These people may hyperventilate also. Okay. Okay, now let's move on to dissociative or conversion disorder. See, dissociative or conversion disorder, they are saying somatoform disorders. There is no physical explanation for this. That's what they are saying. There's no physical explanation for this. So there is some loss of neurological function or distortion of neurological function, but there is no disease at all. Like these people have some amnesia, dissociative blindness. So basically, there's nothing wrong, but they'll be walking in a strange way, functional gait disorder. So here you can see conversion disorder and dissociative disorder. Now the same thing has become two headings now, right? So conversion they are putting under motor sensory, dissociative they are putting under consciousness, identity, memory. Okay. In psychiatry, almost all treatment, you should rule out all other causes. Okay. And you should check if these people have some deficiency of any vitamins. Right? You should rule out all these. Then only you should come psychotherapy, understand them. Then cognitive behavioral therapy. That means what? Behavioral therapy you would have heard. Cognitive, that means the person is aware, is it? Then drugs like benzodiazepine, SSRIs, antipsychotics. See, these are standard drugs you will write in the entire psychiatry. Okay. Now we are moving on to this one, anorexia nervosa. In this, the person won't eat at all. But in bulimia nervosa, these people binge eat. Okay, they binge eat and then they vomit or they purge. Okay, they take purgatives and they lose weight. Okay, and bulimia nervosa people will usually actually look very normal, but they'll have a lot of esophageal tears, etc. because of the vomiting. See, that's what we told you. Anorexia nervosa won't eat, but bulimia nervosa, they will eat. Okay, and they'll vomit. Okay, so this is bulimia nervosa. This bulimia nervosa is more common than anorexia nervosa, they are saying. Okay. And this bulimia nervosa will come later, late adolescence or early adult life. Okay. Anorexia nervosa can come early in life. So they will, anorexia nervosa, how will you determine? This is the diagnostic criteria. And bulimia nervosa, how will you diagnose? Okay. That's what they are trying to say you. In bulimia, we told you they will binge eat and they will self-induce vomit. So bulimia nervosa, because they are putting their hand in and they are trying to vomit, that's why these knuckles will have this kind of calluses. This is called as Russell's sign, okay? And even their teeth, because of all the acid coming out of the stomach when they vomit, they'll be pitted teeth. So these are some important things that you should know about bulimia nervosa. They vomit, okay? So that's it. And one more thing we told you, the esophageal tears will be there because of all this forced vomiting. Mallory-Weiss tears, okay? This is also important terminology that you will write. Now comes the question, how will you treat? So basically you will give them fluoxetine, same thing, Fludac, right? Antidepressant, same treatment only they are talking about, okay? These people have fear of becoming fat, etc. just like the anorexia people. But what these people, finally they can develop anorexia nervosa, okay? Bulimia nervosa can finally become anorexia nervosa and they can stop eating. Strange world, strange problems. Some people don't have food. Some people have food, but they want to vomit it out. Okay. Now let's move on, people. Now let's look at the last one here, puerperal psychosis. This is something to do with the obstetrics, puerperal psychosis. Or there is one more here, postpartum depression they're calling as. Again, here we are showing you the book Davidson because Davidson is the best. It has general medicine, dermatology, psychiatry, everything included, and Davidson is the best according to us. No, we are not sponsored by them. Okay, now puerperal psychosis, guys. So basically after childbirth, that's what. So this becomes a differential diagnosis for schizophrenia. If it is after childbirth, it can be puerperal psychosis. Okay. So what happens here? There is because of what did they say? Okay, so the cause they are saying is family history of bipolar disorder. Okay, bipolar means obviously they have depression and mania, right? And there'll be fluctuation, a lot of fluctuation. So in these people, the common features are suspiciousness, concealment, and impulsivity. Okay, and this is a risk to not just the mother, even to the baby. So you should give this antipsychotic medication, mood stabilizers, etc. And most of the women will recover, but the recurrence can be there in subsequent deliveries. That's why in these movies, no, they show the mother after the second childbirth becomes this disorder, schizophrenia. Guys, there is a correction here, okay? Actually, postpartum puerperal, there are a lot of problems, okay? One of them is this depression, postpartum depression. But postpartum depression is a small issue, okay? This puerperal psychosis. Psychosis is the schizophrenia kind of thing. Psychosis is always bad. Neurosis is still better, right? This is more like a neurosis. This is more like this is a psychosis. There's one more here that you should know. That is postpartum blues, okay? So please note that one more thing is the postpartum blue. Give us a blue, please, blue, yeah. Postpartum blues. So what are the three things? Blues, depression, and psychosis. So how is it going, people? Did you understand? Postpartum blues, postpartum depression, postpartum psychosis. Now you have understood that these are the top priority questions that they will ask you in psychiatry, correct? And you have also understood which textbook to read for psychiatry, correct? Davidson. Now, there are some questions which are not top priority. Look at them. These have been asked in the exam, but only one time like that. Dementia, difference between normal and abnormal behavior, mini mental status examination, how to do, delusion, hallucination, mania, psychiatric emergency, behavioral therapy, dementia in elderly, Alzheimer's, chronic alcohol misuse, Lewy body dementia. So this Lewy body dementia is a disease associated with the abnormal deposit of protein in the brain, that protein is called as alpha-synuclein protein, okay, some protein in the brain, okay, causing dementia. Drug abuse, you should talk about drug abuse. Korsakoff psychosis, again this you will see in thiamine deficiency. This is kind of an irreversible condition, right? Korsakoff's psychosis is important. Wait, let me show you. See, these people will have memory deficit and confabulation. They'll make up stories, okay? Memory deficit and they will make up nice stories, okay? Then catatonia, we showed you in schizophrenia. Psychosis is nothing but schizophrenia, postpartum psychosis, etc. Basically, psychosis is a severe form that is difficult to treat. Neurosis is still better. Antidepressants, like we showed you, SSRIs, tricyclic antidepressants, etc. Bipolar affective disorder, tricyclic antidepressants like amitriptyline, right? So imipramine, all those drugs. And what are the problems? Why don't you use tricyclic antidepressants? Because of all those negative effects that it has. Lithium they will use in mania, right? Then teratogen, it is in the pregnancy. See, drugs for bipolar disorder, you have lithium. You've studied all this in your pharmacology. See here. Lithium was the first drug that was used, right? It has a lot of drug interactions with these diuretics and it can lead to toxicity also, lithium toxicity. If someone has the lithium toxicity, how will you treat? You will stop the lithium, then you will give mannitol to excrete it, then you will give normal salines to reduce them, to restore the sodium levels, right? And hemodialysis also you can do to remove this lithium. Okay, let's move on. Then panic attacks, we have already told you. Then obsessive compulsive disorder. This is something that will, it's not just about keeping your house clean or arranging things. It is when it starts affecting your life. The obsession starts overtaking and it is very difficult to live with it, okay? Then coming to post-traumatic stress disorder, this is again after some kind of a trauma in the life, like a child loss or something. So this, you'll have to look at. Then chronic fatigue syndrome. What is this? So this is coming under the somatoform disorder, excessive fatigue after minimal exertion, okay? So this can be after a viral infection, etc. And this can happen with depression and anxiety. So same thing only they are telling, cognitive behavioral therapy, etc. Same thing only they are telling, carefully graded exercise with cognitive behavioral therapy. See, same thing they are trying to say, okay, take full history, exclude everything else, look for any deficiencies and fix them, right? Then you can just give some psychotherapy, then you can emotional therapy, etc. Cognitive behavioral therapy, then what else? Rehabilitation, etc., etc. Psychiatry, you'll write same thing. Conversion disorder, we looked at. What is this Munchausen's syndrome faking? That means these people are faking. Munchausen's syndrome. Munchausen's syndrome. It's like malingering. So they basically, they just fake it, kind of a thing. Okay. Okay. So basically in this video, you looked at the top priority questions from psychiatry, and also you have looked at all the explanation also. This much if you know in psychiatry, it's more than enough, guys, to pass, looks like. So focus on these questions that we have mentioned here. Read more about those top priority, these questions, okay? So that if they ask for more marks, you'll be able to write a lot, okay? What else, people? That's all for from our side. Remember, it is enough if you read your general medicine textbook. No need to buy separate book and all. This much is enough for your general medicine psychiatry. Okay, bye-bye.